Dr. Paul here. I've got a little baby who's got some really noisy breathing. Let's go take a look. Hi, how you doing?
Pretty good.
Oh,
Couple babies. Yeah.
oh, baby, it's okay.
I know. So it started yesterday morning. She woke up pretty hoarse and kind of had this classic barky cough. The more upset she was, the worse she was coughing.
Yeah, that's so classic with this.
Worse at night.
Hey, baby.
So we did some time in the bathroom with warm, steamy shower. Seemed to help. And nursing, just trying to keep her calm and not crying.
Good.
And then this morning she just wasn't kind of bouncing back with her interventions like she normally would, or she was.
Did she get any better at all this morning?
Not really this
Not
morning.
really.
Last
Okay.
night she responded to it better this morning. And even at rest she had some pretty noisy breathing and she wasn't upset. Breathing pretty fast.
And I understand she's pretty warm.
Yeah, she's got a fever. She had one last night. Today she's 103.
103 today. And she had an ear infection last week, didn't she?
Right.
Yeah.
She's
Oh, baby.
antibiotics for it.
All right. She's about halfway through an antibiotic course?
Yeah, a little over half.
Yeah. So folks, I was already in before and I looked in the ears. They're a little bit red, so the ear infection is partially treated at this point. The lungs are crystal clear. The throat's okay. I got a good look at the throat. I even saw the epiglottis. It presents like croup, right? A really harsh, hoarse, right? You hear that respiratory sound, raspy inspiration, like that. Noise on inspiration, like we're hearing, that's croup. Contrast that with wheezing, which is an expiratory squeak, like that. So this is a croupy presentation, which means there's narrowing of the airway and swelling in the airway. So what we're doing, we've checked on oxygen. It's 97% on room air, which is fine. But obviously, this little one's in distress. So we're giving a racemic epinephrine treatment, and we're going to observe here for a while. That's something that you don't just give and then send the patient home right away, because there's enough distress, and we're still here, middle of the afternoon. With classic croup, you're kind of fine during the day, and then you're a lot worse at night. So when it's this bad during the day, there is a slight chance that we may end up in the hospital for close observation, but sometimes we can get lucky with the treatment, so we'll see how that goes. And we're going to check for whooping cough. There has been some of that going around. It's not a classic thing for whooping cough to present with croup, but it can, and we don't want to miss that. That's treatable. We're going to get a CBC, complete blood count. We're going to do a nose swab for pertussis that you're going to see here in a moment, and then we'll regroup, see how we're doing. Time for Decadron, and then a pertussis swab, and then a CBC.
Yay!
Yay!
Oh.
I see you're excited. Are you excited?
So excited!
Okay. We have the best team. Best.
True.
Yeah. All right. We're going to do a few different things here. You need your medicine? Will you swallow? There you go. There you go. Good job. There you go. Oh, done. Okay. I'm just gonna go. Swallow. Swallow. I know. I know. Hey, girlfriend. She's strong. Should have warned you about that. That's okay. That's okay. There you go. Go really quick. I'll done it. Oh, got it. Okay. Dr. Thomas will be in just a minute to review the CBC with you.
We got our labs back. So what we've got is a normal white count, which is really good. With pertussis, we often will see that very high.
Okay.
So that's somewhat reassuring that it looks totally normal, 11,000. Okay. And the types of white blood cells are also reassuring. With pertussis, we often see this number go really high, high lymphs. We're borderline anemic, nothing to worry about for age, that's common. And platelets are 200,000, which is also normal. So it's looking like it's going to be just a really bad case of croup.
Okay.
All right.
Sounds good.
Good.
Thank you very much.
So we'll be checking in on you, and hopefully we're getting you home today.
Okay.
All right. So folks, big thumbs up for this amazing family, mom and baby here, who let us have a peek at a really bad case of croup. I think for families at home, you have a kid who's slightly croupy and they're acting totally fine, and especially if they're older, no big deal. But when you have a little one, an infant under the age of 1, who's clearly struggling, right? You get that, you can't ignore that. You've got to get into your doctor. If you don't have a doctor and there's an emergency room available, you get into the emergency room. Very rarely it could be something like whooping cough, which is treatable, and sometimes kids actually need oxygen or continual treatments with the racemic epi or something like that. So big thumbs up. Thanks for watching. I'm Dr. Paul. So folks, our little one with croup I had to send to the hospital after a couple hours of observation. We had done the racemic epi treatment, multiple rechecks. We still had severe stridor. We had some retractions between the ribs, obviously still working hard to breathe. And one of the things you have to know if you're ever going to use racemic epi is there's a chance for rebound worsening when it wears off. So that mom happened to live like an hour away from here in a very rural area, and it just was not going to be good to have that baby at home at night, far from any hospital, and possibly getting worse, which croup kids tend to get worse anyway at night. So I thought she'd turn around, because usually with the Decadron, the steroid, most kids will turn around enough where you go, oh yeah, you're gonna be fine. Wasn't the case this time, so that's an example of a case of croup in a very young infant that's bad enough to need hospitalization. It happens very rarely, but I wanted you to kind of see, we've had other cases of croup where they were just fine. And it's not how they sound, it's how they look and how hard they're working. Just, you can see, as you saw in this video, this little baby's working hard. So in the hospital, they will have continuous monitoring of the oxygen, and they'll do repeated treatments if needed of racemic epi. Sometimes if we're lucky, the steroid that was given here in my office will start to kick in to the extent that actually all they need is close observation, and by tomorrow morning that baby will be going home. That's what I actually anticipate will happen. Although there was enough difficulty in breathing and we're getting into the harder time of the day, which is the evening and night, I'm suspecting they'll do a couple treatments of racemic epi for this baby, and of course the close observation. So it's not up to you, the parent, to try to decide, is my baby bad enough that I need to be going into the hospital? You're already in a safe place where you're being monitored by nurses and technology, right? We can check heart rate, respiratory rate, pulse ox, in other words, how well you're oxygenating, all continuous if necessary. Thanks for watching. I'm Dr. Paul.